Let's talk about when it's time to potentially go seek mental health professional help versus you just need to work on getting more confident with your answers regarding your nervousness or anxiety about the NPTE. I've helped a lot of students in the past pass this thing, but as a coach, I can basically address those issues where you are not having enough confidence about the test, that you need to understand the information a little bit better, get a better grasp on things, take the test in a more efficient way, identifying your mistakes and moving forward with that. In order to get to the place where you can be coached, you do have to make sure if you are having any of these symptoms of diagnosed clinical anxiety, which obviously I'm not somebody who can diagnose that. However, as a doctor of physical therapy, we did learn when it's time to refer people to go to various different specialties, which can include seeking mental health professional help. I have been in and out of therapy for years, since I was 13. So more than half of my life, I have been in and out of therapy, working on things including anxiety, ADHD, other, issues that I've had in the past. I have gone in and out of therapy to work on these things and better myself, so I can have a better introspection, know what my triggers are, know what works, know what doesn't work, so then I can become a better member of society and I can live a happier, more fulfilling life. There is nothing wrong with doing that. There's also nothing wrong with potentially going down the medication route. I've tried different types of medication. I've been on and off different medicine, and I've been just selecting things that work for me based off of what I need. Using therapy and using medications is a tool you can use to help you get to your goals. That's just what I'm trying to explain here. So if you're finding yourself when you're studying for the NPTE and you're getting really anxious about it, it's important to notice, okay, is this just a normal nervousness about the test where you should be a little nervous about the test. It's important, but it shouldn't be to the point where it's debilitating your life. So if you're just nervous about it in the way of I want to do well, I don't want to let myself down, I want to make sure I'm taking this seriously, I want to do well because I've worked so hard, that's normal. It's very normal to feel that way. What's not normal is having your anxiety disrupt your life, such as you're not sleeping at all, or you're not motivated to do anything, or you're withdrawing from people, or even the opposite, where you're starting to blow up on family and friends, ruining relationships, starting to have issues with attending work and doing your jobs and doing your normal activities of daily living. If your anxiety is getting about the NPTE is getting to the point where it's impacting your ability to live a fulfilling life, that's where you really need to be seeking mental health therapies and potentially medication. Now, I'm not saying this is exactly what you need, but I'm essentially showing you the signs and symptoms that would point towards this is probably the support needs that you need. They're tools, just like how the PEATs are a tool to help you study, just like how driving a car is a tool to help you get to work and stuff like that. It's just tools that you can use to improve your quality of life. And I want you guys to live fulfilling lives. I've had students that come to me for coaching, and as a coach, I can't do therapy with you, obviously. I am only licensed to do physical therapy. I can't do mental health therapy. However, as a coach, I am somebody who's been through all of these therapies before. I understand. I can help you on the opposite side once you've already gone through the other therapies with their mental health friends. It's a similar thing as, somebody needs a knee replacement. They go to an orthopedic surgeon, get their knee replaced, and then they come to physical therapy to work on strengthening and getting back. Me as a coach, what I work on is I'm helping you understand the information better, feeling more confident going through your tests, working on different test taking skills and strategies to improve your performance. I'm just another tool that you can use. However, I would be doing you a disservice if I said I could cure your anxiety. I cannot do that. What I can do as a coach is I can improve your ability to understand the information better, feeling more confident with the test. And really that's what I try to go at, improving your confidence and making you feel better about your ability to pass the test. However, if you feel like you've fallen into that category that I described where your anxiety is consuming your life, you're having very explosive or visceral reactions to things going on in your life, that's where you might need to go seek some mental health therapy. And I've had students who go to those professionals, work on things with them, and then come back and pass the boards with a 100-point increase from their last test because they addressed the things that they needed to address. And that's the most important thing, guys. I want you guys to be successful. Me as an NPTE coach, I'm not trying to solve all the problems on earth, but I want to just let you know it's okay to seek mental health therapies. It's okay to be on medication. It's okay to seek accommodations. You'll go on the FSBPT website, go to the accommodations page, you print out a form, you have your doctor sign it, you send it to the FSBPT. It's a pretty straightforward process if you need to go that way. These tools are all available for you to help you pass the boards, okay? I know that this is also coming from a place of privilege where I have health insurance that I'm able to do these sort of things, but I just want to let you guys know there is hope if you're feeling hopeless. And this is the difference between feeling just normal anxiety about the test versus a clinically diagnosed anxiety. I want to make sure that this is just abundantly clear, because I think a lot of people don't realize these are tools that are available and you can use these, and they really do improve your quality of life. So hopefully this helps somebody, but I just wanted to come out and tell you guys about these different things to help you out. If you have any questions, you can always message me, but just understand that my scope of practice ends at physical therapy.